going through the stress. I'm always glad when the glitch is not my fault because I'm such a digital dinosaur. Okay, we are going to start now. Welcome to today's American Community Media Special Thursday, California briefing. I'm Sandy Close, your moderator for today.
Bienvenidos al informe especial de hoy de California.
Could whoever is
I think you're not in the Spanish channel.
could whoever is Hi, everyone. We're going to start as soon as our interpreter channel glitch is resolved. I'm sorry for the delay.
It's resolved.
Are we okay to go, Jessica? Jessica, can you give me the green light?
Yes.
Okay, great. All right, we're going to start again, but I'm going to get right to the point. Our topic today is how federal and state policy changes to Medi-Cal, California's version of Medicaid, are reshaping how millions of Medi-Cal members can access vital healthcare benefits and services in the year ahead. In this briefing, policy experts from the California Department of Healthcare Services, DHCS, will explain the latest changes affecting Medi-Cal and what they mean for members. Topics will include updated federal immigration status classifications taking effect in October 2026. New federal work and community engagement requirements, and the transition of approximately 2 million members from managed care to the Medi-Cal fee-for-service delivery system beginning in January 2027. 6-month eligibility checks for some adults beginning on March 1st, 2027, and new monthly premiums for some adults, as well as dental benefit changes beginning in July 2027. Speakers will also explain which Medi-Cal services and benefits will continue to be available, who is affected by the changes, and what members can do to keep their coverage. Attendees will learn about important deadlines, eligibility requirements, and resources to help eligible individuals and families maintain access to Medi-Cal. We welcome our expert panel, Tyler Sadwith, State Medicaid Director at DHCS, Yingjia Huang, Deputy Director for Healthcare Benefits and Eligibility at DHCS. Please speak at a moderate pace because of our interpreters, and reporters, please enter questions in the chat. Rather than a question and answer period after each speaker, our speakers will present each for about 20 minutes, and then we'll open the final time in this briefing to question and answer period. Our speakers should feel free to answer questions in the chat during the briefing. So let's start with Taylor Sadwith, State Medicaid Director at DHCS, who will talk about the broad federal and state landscape of changes to Medi-Cal in California. Mr. Sadwith, thank you so much for joining.
Thank you. Good afternoon, everyone. My name is Tyler Sadwith, and I am California's State Medicaid Director. I want to say thank you to everyone for joining the California Department of Healthcare Services for this media briefing. You are the trusted voices in your communities, and many Medi-Cal members rely on you for clear and accurate information. So thank you for helping us in our mission to help Medi-Cal members keep their coverage. Today, we will focus on the Medi-Cal changes that members need to know, including federal changes that take effect beginning early in 2027 that impact some Medi-Cal members. We will also focus on several state changes to Medi-Cal affecting some immigrant members, older adults, and people with disabilities, and these take effect later on in 2027 in July. Before we get into the details, I want to start by acknowledging that some of the dates of implementation that we previously shared with you all have been updated. They have changed. Since our last briefing, the California legislature and the governor enacted the 26-27 state budget. And the budget for this year delays the implementation of several changes to Medi-Cal. It also makes other updates to how and when these Medi-Cal policy changes take effect. So today we will walk through the updated timeline and clarify when changes happen. I will walk through changes that begin in January 2027. My colleague Yingzhe will explain changes that will happen in July 2027 and after that. We know these dates can be difficult to keep track of, so we encourage our members and our community partners to check the DHCS Medi-Cal Changes website for current information. Taking a step back, just to provide context, Medi-Cal continues to cover doctor and hospital visits, emergency care, drugs and prescription medication, services for mental health and substance use disorder, preventive care, long-term care, and then supports like transportation, as well as vision and dental services for most members. So the most important message for members is this: please keep using your benefits, please keep your contact information up to date, and please respond quickly to notices that you receive from Medi-Cal. Before we dive in, I want to provide clarification regarding important protections that remain in place for children, pregnant people, and former foster care youth. Children ages 0 to 18 and pregnant people for the duration of their pregnancy and for 1 year after pregnancy ends can continue to receive full scope Medi-Cal regardless of immigration status. People who are under the age of 26 who were in foster care on their 18th birthday also remain protected from several of the changes that we'll be discussing today. I also want to highlight one change that just went into effect as of January 1st of this year, 2026. As of January 1st, some adult immigrants, including undocumented adult immigrants, can no longer newly enroll in full scope Medi-Cal. So people who already had full scope Medi-Cal and people who have Medi-Cal today can stay covered, and as long as they remain eligible and renew their Medi-Cal eligibility on time. So no one who has Medi-Cal today will be losing Medi-Cal as a result of this policy. But this is a freeze on enrollment for new applicants who are not enrolled today. If coverage ends because of a late renewal or missing paperwork, members have 3 months to fix the issue and keep their Medi-Cal. After that period, people who are affected by this freeze in enrollment for new undocumented adult immigrants can generally only apply for restricted scope Medi-Cal, which covers emergency care, pregnancy care, and certain nursing facility care. Children who are aged 0 to 18 pregnant people through 1 year after pregnancy and former foster youth under the age of 26 can still apply for full scope Medi-Cal regardless of immigration status. Now I want to highlight some changes that take effect this January. Starting January 1st, 2027, some adult Medi-Cal members between the ages of 19 and 64 who do not have children or disabilities may need to report or demonstrate working, volunteering, attending school, or participating in job training to get Medi-Cal or to keep their Medi-Cal. Specifically, members can meet this new federal requirement by working and earning at least $580 per month, participating in qualifying activities for at least 80 hours per month, such as volunteering, attending school at least half-time, or using a combination of those activities. There are many people who are exempt from this new federal requirement, including pregnant and postpartum people, parents and caretakers of children ages 0 to 13, people with disabilities or serious health conditions, people who have Medicare, American Indians and Alaska Natives, certain former foster youth, and people recently released from jail or prison. Medi-Cal or the county social service offices will contact members if these new federal work requirements apply to them, or if more information is needed to help keep their Medi-Cal. There's another federal change that takes place early in 2027. Starting March 1st, some adults who are aged 19 to 64 will have their eligibility for Medi-Cal checked twice per year instead of once per year. Pregnant and postpartum people, American Indian and Alaska Native members, certain former foster youth, and others will continue with having their Medi-Cal eligibility checked only once per year like it happens today. We encourage members to open notices from Medi-Cal right away and respond by the deadline to avoid losing coverage because of missing information or paperwork. There is one more federal change that I want to share information about that takes place January 1st, 2027. Starting January 1st, some immigrant members, including undocumented immigrants, as well as other Medi-Cal members with different immigration statuses, will move from receiving health care through a Medi-Cal managed care health plan to Medi-Cal fee-for-service or traditional Medi-Cal. This change simply changes how members are able to access care, but importantly, it does not mean that they have to pay for services. Members who transition to fee-for-service Medi-Cal can continue to see doctors and clinics that accept fee-for-service Medi-Cal. Medi-Cal will continue to cover prescriptions, and specialty mental health and substance use disorder or addiction care will continue to be provided through the county behavioral health plan. There are certain services that are only available through managed care plans, such as enhanced care management and community supports. So these individuals who transition out of managed care plans will no longer have access to those services. However, there are other services and supports that will remain available, such as community health worker services or promotoras, as well as doula services and more. DHCS will provide transition support, including a nurse advice line and community navigators to help these members receive continued access to care as they move out of managed care and into traditional Medi-Cal. So these are significant changes, but they do not affect every Medi-Cal member. We will continue to provide information before new requirements take effect to help members understand what they need to do. So thank you. I will now pass it over to my colleague Yingja to discuss changes that are coming to Medi-Cal members starting in July 2027 and later on after that. Yingzhe?
Thank you, Tyler, and good afternoon. I'm Yingzhe Huang, Deputy Director of Healthcare Benefits and Eligibility at the Department of Healthcare Services. As Tyler mentioned, the 2026-27 California state budget has changed the timeline for several of the state-level Medi-Cal policies that we previously briefed you on. And I'll talk about what those are in a little bit. The updated timeline gives our Medi-Cal members more time before these changes do go into effect. And we want to make sure our families understand the new dates and what, if anything, that they need to do. And I will share a little bit in terms of how the department plans to share this information with our families, as well as I walk through the changes that are coming up in July of 2027. So on July 1st of 2027, federal rules will change how some immigration statuses are classified for federal Medicaid funding. These immigration statuses include refugees, asylees, humanitarian parolees, and certain survivors of domestic or human trafficking with pending immigration cases. People affected by this federal change will receive what we call state-funded full-scope Medi-Cal through June 30th of 2027, meaning that truly from their perspective, the Medi-Cal coverage doesn't change for them. It will be very similar to what they're receiving today, say in 2026. However, starting July 1st of 2027, people in this group will generally be limited to pregnancy-related care and emergency services only. And before these changes take place, we will make sure that individuals impacted by this change do receive letters from the department and kind of what they need to do as we navigate this change. Also, starting July 1st of 2027, some adults will no longer receive full Medi-Cal dental benefits because of their immigration status. We talked about this in the last briefing. This is a year later. The implementation date has been delayed to July 1st of 2027. Now, this does not impact every single Medi-Cal adult, only certain adults with certain immigration statuses. Emergency dental care will remain covered, including treatment for severe tooth pain, infections, and tooth removal, etc. Children ages 0 through the age of 18, pregnant individuals through their 1 year after their pregnancy, and former foster youth under the age of 26 will continue to receive full dental benefits. Also, starting in July 1st of 2027, some immigrant Medi-Cal members ages 19 through 59 will need to pay a monthly premium to keep their full scope Medi-Cal. And this monthly premium could be anywhere between $30 to $50. And additional communications will be released from the department as we continue to work through this. However, if the required premiums are not paid, and this is monthly premiums, coverage can change to restricted scope Medi-Cal, which is emergency and pregnancy-related services coverage only. Members who are impacted will receive notices explaining what they need to do in that very scenario. Children, pregnant individuals through their 1 year after pregnancy, and certain former foster youth under the age of 26 are not subject to this premium. And again, this monthly premium there's an effective date of July 1st of 2027. And it's only for certain immigrant Medi-Cal members and not for all Medi-Cal members. And the age is 19 through 59. On October 1st of 2028, there is a federal change that will be impacting some adults ages 19 through 64 who are not pregnant, not on Medicare. and make more than $15,560 a year, where there may be some co-payments for certain types of care, such as specialty care, treatments, or tests. Co-payments will not apply to services such as emergency care, regular checkups, pregnancy care, pediatric care, mental health and substance use treatment, or care at community health centers or rural clinics. And more to come on this, but really wanting to highlight that this is a change that will be impacting our members beginning October 1st of 2020. I want to double down on what our members should do now. It's very important, given the changes that Tyler and I talked through, that the members should keep your mailing address, email if you have one, and phone number current with your county Medi-Cal office. Meaning that if something changes, that you should be reporting it to your counties within 10 days. Open letters, text messages, and emails from Medi-Cal or your county, and make sure you're responding quickly when there is a request for additional information. Renew your coverage on time and continue using your Medi-Cal. As a reminder, your renewal packets will still come to you in yellow envelopes. So it's very important if you do receive that yellow envelope from your county office that you open it quickly and make sure you fill out the packet of information and send it back to the county, or you could do your renewal online as well on benefitscal.com if you have an online account. If you're unsure whether the change applies to you, use the DHCS Medi-Cal Changes website. A colleague will post it in the chat for you. And also, given that many of the changes that we talked about today speaks to immigration statuses, we also have an immigration status chart that's available for you to review, or you can alternatively contact your county Medi-Cal office. So for our media partners here, please help us reinforce the message that Medi-Cal is still here. Their Medi-Cal is not going away. Most members will actually not see the changes that we talked about. And members should keep using their benefits and respond to Medi-Cal notices on time. So it's very important, again, that if your renewal packet is coming, and usually it's in a yellow envelope, that you must open and respond quickly by the timeline that's in the letter. And so again, really wanting to thank you for helping our community understand these changes, and we're happy to answer any of your questions at this time.
This is it's such a vast amount of changes, and there are many questions which Griselda has answered some. So I'm going to try to maybe repeat some of the questions that Griselda answered, just so that everybody has access to the answers. But one question I've had is, what really is the difference between managed care and fee-for-service? I don't quite understand how the shift of enrollees from managed care plans to fee-for-service care, what that actually is going to look like. I don't know, Yingjia, if you want to answer that, or if Tyler, whichever.
Thank you, Sandy. That's a great question, and I'd be happy to share a little bit of information about that. So, historically speaking, most Medi-Cal members used to receive traditional Medi-Cal or fee-for-service Medi-Cal, which means you receive a card, some call it a BIC card, and you can go to a doctor or a clinic and receive your services by presenting that card. Over the recent years, the state policy has changed so that more Medi-Cal members receive Medi-Cal through a managed care plan. And what this means is that when people enroll in Medi-Cal for the first time, they're in fee-for-service for sort of their first month, and then they choose a health plan that is in their area. So in Los Angeles, for example, they might have LA Care or HealthNet. Some people might have, Kaiser. If you live, near me, you might have Contra Costa Health Plan or Alameda Alliance for Health. If you live in the north, you might have Partnership Health Plan. So these are names of different health insurance plans that help administer Medi-Cal. So people who are enrolled in a Medi-Cal managed care plan will also receive a card in the mail with the name of their plan on it, and they'll receive a handbook in the mail with all the providers and benefits that are available through that plan. So some Medi-Cal members may think they have LA Care, or they may think they have Partnership, and they may not even be aware that they actually have Medi-Cal as their source of healthcare coverage. So some of the differences between managed care Medi-Cal and fee-for-service Medi-Cal primarily are some of the benefits that are available under CalAIM. I mentioned enhanced care management and community supports. So these are some services that are only available for Medi-Cal members in a managed care plan. And once Medi-Cal members move into fee-for-service, those services are not covered in fee-for-service. However, there are very similar services that can provide ongoing support and care coordination. The other major difference really is about which doctors and which providers will accept fee-for-service Medi-Cal. So for members who are transitioning, we encourage them to talk to their doctor, talk to their provider, and ask them, can I keep seeing you? Will you accept fee-for-service Medi-Cal? Because some doctors and clinics and providers may only choose to participate in a managed care plan under Medi-Cal, but not in traditional Medi-Cal. So I know that's a lot of complicated detail, but I hope that's a helpful explanation.
It definitely is. I want to go back to Araceli Martinez's question, which has been answered in the chat, but I think is still probably one of the most significant questions people have. Araceli, do you want to ask your question, or maybe I will just, in the interest of time. There will not be new enrollments for undocumented adults. We understand that. But my question is, as long as undocumented immigrants continue to sign up on time and are already enrolled, can they keep receiving the full scope of Medi-Cal? If they don't renew on time or are late, does that mean they lose it forever? Yingjia.
Yeah, thank you. Thank you for the question. And I think in general to say, if you were in full scope Medi-Cal prior to January 1st of 2026, you are what we call grandfathered into the program. You're getting full scope Medi-Cal. And once your renewal comes, your annual renewal for in 2027, when the 6-month renewal starts happening, that eligibility check, make sure you're doing the paperwork on time to keep that full scope coverage. If you don't provide the additional documentation or the package that comes to you from the county on time, you'll be moved into what we call emergency and pregnancy related Medi-Cal. And you can no longer, even if you reapply, you can no longer get the full scope package that you had prior to January 1st of 2026. So I think in summary to say, after January of 2026, even more important to make sure you're filling out the paperwork that you are receiving, whether it be online or through the mail, on time, because there's a deadline that's always on the first page of the packet, and return it to the county by that time.
Could either of you tell us how complicated are the renewal forms? When you get that package, it's been variously described as a large yellow envelope. I don't know whether that's true or false, but could you put yourself in the position of an enrollee and give us your advice? Um, if if somebody has difficulty with English, I'm sure it's been translated. How many languages will it be accessible in? And how long would it take somebody with reasonable familiarity versus somebody with almost no familiarity to fill in the renewals?
Um, so Medi-Cal has 19 languages. We call them the threshold languages, and how the packet is translated depends on the person, the family that was filling out the application. They check the box on the Medi-Cal application in terms of what preferred language they would like to receive their correspondence. And so at the time when you do get your yellow packet, it is a big envelope. Depending on the size of your family, usually the packet will have what we call pre-populated information, meaning that it's quite a few pages long. And again, it depends on the number of people in your family that needs to be renewed. But it will have pre-populated text from the last time you did your eligibility check. And what you have to do is go through it and on all the pre-populated fields, make sure it's still correct for your circumstance now. Basically how much money you're making, how many times you get a pay stub from your employer, for example, correcting ages of your children or of your spouse, et cetera, et cetera. Everybody's situation may be a little different. So it's very important for you to review all the things that have been pre-populated on the field in the renewal packet. And there may be some blanks where the county wasn't able to grab new information in the background. And everything that's pre-populated or already on the packet is usually what any electronic source have come back with, like the IRS, Social Security Administration, EDD, for example. So these are all the information that the county was able to grab and put on the packet, and with a mixture of things that you may have provided the county at some point at your last eligibility check. So again, going through it in detail and making sure that's correct. And then you also have to make sure you sign the packet. Oftentimes we notice our members forget to go to the last page and sign and date. That's usually a very important step, and then you mail it back to the county. But oftentimes the yellow envelope, the first page will have a deadline in your preferred language, and it could be also in alternative format. And we also provide this in large font, Braille, depending on your preferred method of communication. And the packet is only one way. You could do it by hand, or you could actually go online and do it. Even though if you receive the yellow packet, you could, if you have a Benefits Cal account, you could actually also go online. It has the same information, and if it's just easier and much more accessible, you could also do that as an alternative if you just can't take the time to write all this information. So there are a couple of alternatives available.
What county agency or nonprofit agencies at the local level would be most helpful for people to take those packets to and ask for help? Would it be the Department of Public Health? Would it be a federally qualified health clinic? I know you're not going to know at every level what kind of agencies are available, but just in your kind of experience, where would you advise our media to tell people who may really be terrified of what this is going to mean to look to for help?
Yeah, so I have two recommendations. A lot of our 58 counties, not all of them, I will have what we call navigator resources that's funded by the county. Sometimes you may hear them as enrollers. Sometimes you hear them as application assisters, counselors. Every county kind of calls it a little differently. And each county will maintain a list of their local resources. Again, not every county has it, but there are quite a few that are the bigger and mid-sized counties across the state that do have them. They're not funded by the state. The second thing is we are working with to fund and stand up clinic navigators at the federally qualified health clinics. We haven't gotten to a place where we could provide a list yet, but we will soon be able to, and probably in the next few months, have a list of these clinic navigators that are at the clinic itself. So our members, if they have problems with their enrollment, they can probably take the packet and go to their local clinic and ask for assistance. And that is something that the state will be working to fund and stand up in the next few weeks. And once that's available, we will have a list of them available for our media partners to go and help navigate. But right now, absent that being ready, I would recommend there are quite a few local resources at the local county website. And if one of my colleagues can put in the local county listing, and each of the sites will have links to each of the county websites, and a lot of them usually do have some navigation tools to help our members on the ground.
Thank you. Tyler Sedgwick, could you tell us a little more about the work requirements and how will you, Yingxia gave us specific amounts, $580 and 500 hours, the equivalent of volunteer work. How do you prove that? How specific will the renewals be about, proving that you've done the work?
Thank you, Sandy. It's a really important question because this new work requirements rule is a federal change, and it impacts about a little more than 4 million Medi-Cal members who are between ages 19 to 64 and who do not have disabilities or young children. What we are prioritizing at the state is using all of the information that we have access to in our database and in other databases so that we can automatically determine if people meet the rule or if people are exempt from the rule so that Medi-Cal members don't have to take any action. That's our goal. And we've been working very hard over the past year and will continue to work very hard so that we can do this on the back end, so we can automatically help Medi-Cal members keep their coverage if they are subject to the work requirements rule, because we do have information about income. We do have information about disabilities. So our goal is to avoid Medi-Cal members having to provide information to the greatest extent that we can. However, we do anticipate that there will be some members that we don't have information about, and we will have to ask them for information. So members will receive notices in the mail, and the notice will explain, hey, we don't have information about how you're exempt from this, such as having a medical condition that is serious and complex. And it'll have a screener where they can check yes to certain conditions. The notice in the mail will also say, can you provide information about how you worked or how you volunteered or how you were a student for a certain number of hours per month? And that will then help us deem them eligible to keep their Medi-Cal.
Thank you. Would you say that having family care giver responsibilities would qualify as volunteer work in this sort of new work requirement. We think of so many of our families covered by Medi-Cal now who are taking care of family members without pay. And I'm just curious whether we could imagine that enormously demanding job of caregiving being included in work requirements.
So there are some exemptions for parents and for caregivers. So parents and caretakers of children ages 0 to 13 are exempt from work requirements. There are other exemptions, and I'm going to ask Inja to provide more detail about sort of other caregiving and caregivers that are exempt or that counts towards the work requirements.
Yeah, and I think in general to say it would depend on the type of caregiving. If it's a routine, meaning I go and take care of a family member, a close family member doesn't have to be in your household. It could be a relative, and it's a routine basis. You're potentially exempt from this requirement. And I say potentially because in the federal rules, there are very specific kind of descriptions of that relationship. And so the best thing to do in the scenario you do not know is to talk to the county office. And it's everyone's kind of household situation could be a little different. But if it's not incidental care, and if it's routine on a routine basis, and depending on that relationship between you and the individual, it will potentially count as an exemption from the work rules.
Thank you. We have a question. There's so many great questions, and trying to summarize them. And also, I would just urge our media to look at chat because Griselda and Yingjia have answered a number of these questions. But one question is undocumented immigrants who do not have Medi-Cal, when they go to emergency care, do they still have to pay afterwards? And that raises the bigger question, of course, of how Medi-Cal, how DHCS is going to handle the growing number of people who wind up falling off for a variety of reasons, Medi-Cal.
Mm-hmm. And I can start. Tyler, feel free to chime in as well. So regardless of your immigration status, and I think if you have like a life threatening situation, the hospitals are required to render care, big one. But to address the cost component, in the Medi-Cal program, there's something called hospital presumptive eligibility, which is regardless of your immigration status. If you are at a hospital and we have a list of those qualified hospitals that participate in this program, you self-attest to very easy kind of pieces, your name, the income that you make. Again, it does not ask for immigration status. There is an ability for, if you are under the Medi-Cal income limit, you will be what we call presumptively eligible for Medi-Cal, meaning Medi-Cal will pay for the costs of that stay should you be determined eligible. And it's a very quick one-page application. The hospitals could intake and actually take down the responses, getting your consent to provide this to DHCS for review and approval. Almost the review and approval process is instant. It's real time. So the family and the individual will be able to get the results then. And there's a time limit. There's about 45 to 60-day time limit for this coverage. So technically you could be eligible for 2 months. And the requirement is if you want to continue Medi-Cal in the long term, you have to submit a full Medi-Cal application. But if you are in that circumstance at the hospital, there is a potential eligibility pathway for Medi-Cal to cover the costs, and that's called hospital presumptive eligibility. And we could put that link in the chat.
We have had a number of briefings over the last 2 years with DHCS talking about the expansion under Cal AIM. And people were really just so impressed with services like community supports when you are getting out of the hospital after an operation. You can apply for under Cal AIM for help retrofitting your house to make it more manageable. There were just so many community support services. Could one or both of you explain to us what is happening with Cal AIM under the new Medi-Cal? I realize it's a huge topic, but any light you can shed on this would be really helpful.
Yeah, thank you, Sandy. So CalAIM, as you mentioned, offers a lot more services and supports that really get to the root cause of someone's health. The goal is really to go upstream and address conditions in a preventive way and using sort of social supports and other types of interventions to stabilize a health condition before it gets worse. And so, for example, we offer asthma remediation for contractors to come into a house and actually address mold and other issues in a house to prevent and address asthma conditions from becoming a bad medical problem. So some of these supports really are targeted on sort of health-related conditions. It's not just renovations and new bathrooms for everyone. Just wanted to clarify that. They are several ways that CalAIM is changing a little bit with these federal changes. Number one, which we've talked about, are roughly 2 million Medi-Cal members who are going to move from Medi-Cal managed care plans to Medi-Cal fee-for-service due to a federal requirement. And as a result of that, they will no longer have access to the community supports that you mentioned, which are only available to people in a health plan. There is another factor that we haven't talked about, but just for broader awareness, some of these community supports are approved under a federal authority that is expiring at the end of this year. And we are right now in sort of negotiations with the federal government to receive continued approval for these community supports because we know that they're working for our members. So we're in conversations with the federal government. We've submitted an application, but more information will come later on that because no changes are anticipated at this time, and it's not part of the changes that we were highlighting earlier.
Right. Anything you want to add to that, Yingjia? Okay, great. There was a question that Griselda answered, but I think in case people missed the answer in the chat, how much is the premium that some enrollees are going to be asked to pay? And why is the premium being applied to only immigrants? And does that mean only immigrants are the ones paying the premium?
And I can answer the question. So the monthly premiums are applicable for certain groups of immigrants, and that is in the California state budget approved by the legislature. So that's kind of where we're at. And the monthly premium is anywhere between $30 to $50, and this is to be determined as we near July 1st of 2027, and that was a decision from the state legislature just in the past state budget. So more to come on the final monthly premium, but it is anticipated for each individual in the household that are in that certain groups of immigration statuses.
Thank you. A very important question, I think, for those of us as journalists trying to cover dis and misinformation. What is the biggest myth that has emerged regarding the changes in Medi-Cal? Where is the biggest amount of dis and misinformation coming, or sort of what to your view is the most dangerous misinformation about these changes to Medi-Cal? And I'll ask both of you for your opinions on that. And then, unfortunately, we'll have to do our final wrap-up question.
And I think just to offer kind of from my experience, what we have heard in the community is we have heard that Medi-Cal is closing their doors to enrollment, no longer accepting new people into the program. That is obviously not true. As we are trying to share and double down that the Medi-Cal program is still open for enrollment. And the majority of the changes that we talked about today are only applicable to certain groups of individuals and not to everyone. Please continue encouraging your communities to apply through benefitscal.com, coverca.com. And if you're unsure whether you're eligible, we have a screener on the DHCS website for you to fill in for you and your family to see if you are eligible or not. Please continue doing that. The door is not closed. It remains open for all.
And a related question to that, Yingzhe, is roughly how long does it take to process an application?
A full Medi-Cal application under federal law, there's 45 days for the counties to process. However, if you do your application online, which is what we encourage, oftentimes you will get a real-time result, meaning that as you're sitting there doing your application, once you press submit, that oftentimes if the county doesn't need additional information from you, you can see your result right away and print out a temporary BIC card to start accessing services.
Thank you. And Tyler, what to your way of thinking is the most dangerous myth surrounding these changes?
Thanks, Sandy. It's hard because there are a lot of changes, and the changes are technical. Certain changes impact certain populations. They only go into effect at certain points in time. So it's really confusing. I would say one big myth maybe is that work requirements apply to everyone in Medi-Cal. This is a big one, and so I think it's helpful to clarify. Really, the work requirements only apply to Medi-Cal members aged 19 to 64 who don't have disabilities or children under 13, to keep it simple. And even among this population, we at the state are trying to take every step we can to keep you enrolled in Medi-Cal and that you don't have to lift a finger or do anything. That said, we will have to send notices out to Yingzhe, keep me honest, approximately 2 million Medi-Cal members we anticipate not being able for us to deem them exempt or compliant with this rule, and we may have to request information from them. So out of 14 million Medi-Cal members, there are 2 million who may receive notices in the mail from Medi-Cal requesting information so that they can keep their Medi-Cal in response to work requirements.
Okay, final question. Although I know many of us would love to stay on for another however many minutes, because you've been so helpful in kind of working through all these changes, and knowing the right questions to ask is also key to knowing how to inform our audiences about what they most need to know. What would your headline be around the coming changes of Medi-Cal, what would you, representing DHCS, most feel is the most important message we can share with our audiences about these changes?
For
And-
me,
Okay.
I think the most important thing is make sure if Medi-Cal sends you anything, whether it be through mail, text messages, or email, please make sure you're opening it and reading it thoroughly. And if you need it in your preferred language, please call the county so that you could access the information. There are big changes coming, and we want to make sure you're informed.
That's very helpful. Tyler, what's your most important message?
The same as Yingjia's. So I put it in the chat. It's, please keep using your benefits. If you have Medi-Cal, please keep your contact information up to date. And when you receive notices from Medi-Cal, please respond to the notices as quickly as you can so that we can keep you covered.
Okay. I you see, the amazing thing is you don't always know what you don't know. And as you begin to know more, you have more questions. So you have opened a Pandora's box with many questions, which we don't have time to address. But thanks to this wonderful partnership we've had as ethnic media with DHCS, I want to just get your reassurance. If we send you follow-up questions and they're very simple and very straightforward, it will help us. We'll coordinate the responses, and we truly appreciate the time and expertise you've brought to us on this absolutely critical issue for our audiences. Thank you so much. And thanks to everyone, including our interpreters, for being on today's call. Our conference is ended because I know our speakers have to go to yet another demand for more information. So thank you so much.